Hi, so this video is about the medication known as clozapine. So, what is clozapine? Clozapine is the generic name for a type of medication. The brand names for this medication are Clozaril and Fasaclo. They are atypical antipsychotic medications, sometimes known as second-generation antipsychotics. They are used to treat treatment-resistant schizophrenia. Therefore, they are often prescribed when other medication/treatment has failed to improve these symptoms. As well, they are often prescribed in order to reduce suicidality that is often comorbid with schizophrenia. They are taken orally as a tablet 1 to 3 times a day. So what are the symptoms of schizophrenia? The symptoms of schizophrenia are often categorized into positive and negative symptoms. Positive symptoms include delusions, hallucinations, disorganized speech, agitation, and catatonic behavior. Delusions are either bizarre or non-bizarre. Bizarre means they are incapable of actually happening and not physically capable of occurring. Non-bizarre means that in some relative form they are capable of occurring. For instance, someone might believe that a celebrity is in love with them, which is possible, but the probability is negligible. So then, hallucinations are sensory perceptions without input, the most common being auditory and visual, meaning you actually will believe that you're hearing or seeing something. Disorganized speech can include echologia, which is when you repeat what is said to you. For instance, if you said, "Hello, my name is Courtney, nice to meet you," the person would say back at you, "Hello, my name is Courtney, nice to meet you." Loose associations and word salads are also categorized into disorganized speech. Then there's also agitation and a kind of catatonic behavior. For negative symptoms, affective flattening is when there is little emotional facial response. Therefore, the person would probably most likely speak with a monotone voice. They wouldn't smile or frown or any similar reactions. Avolition is the lack of will to do anything. Anhedonia is a lack of interest or lack of pleasure from previously enjoyed activities. Most notably, this is social withdrawal. Finally, there is alogia, which is a lack of elaborative speech. Basically, you'd get yes or no answers from someone. These symptoms usually last for 6 months before a diagnosis of schizophrenia occurs, at which point clozapine might be prescribed. Since clozapine is a second-generation antipsychotic medication, it would help alleviate both of these symptoms. Other symptoms of schizophrenia are cognitive and mood symptoms. These symptoms are typically not as severe as the positive and negative symptoms, which is what clozapine really addresses. However, cognitive symptoms include attention deficit, memory lapses, poor abstract reasoning, basically an inability to concentrate or focus. Mood symptoms include euphoria, apathy, grandiose ideas, belligerence, dysphoria, or inability to have pleasure. These are help alleviated by clozapine, however not to the degree that clozapine is intended to help alleviate the positive and negative symptoms. So I'm now going to get into the MOA, or mechanism of action, of clozapine. I will begin with the macroanatomy of it and then later get into the microanatomy. By the macroanatomy, I am referring to the actual brain pathways and circuits that clozapine will affect. Basically, clozapine affects regions of the brain that are dopamine hyperactive or hypersensitive. Usually these are the temporal lobe, the prefrontal lobe, and regions that correspond to speech. It particularly focuses upon the integrative dopamine hypothesis. Beginning with the mesolimbic pathway, clozapine binds to dopamine, serotonin, GABA, and glutamate in order to help alleviate some of the positive symptoms. Then it corresponds to the mesocortical, to the DLPFC, or the dorsolateral prefrontal cortex, and the mesocortical to the MPFC, ventromedial prefrontal cortex, in order to help alleviate the negative symptoms and cognitive symptoms. It then corresponds to the nigrostriatal and the tuberoinfundibular pathways in order to maintain their levels of concentration of neurotransmitters. So now some of the microanatomy of the MOA. As I said before, clozapine works on areas that are hypersensitive or hyperactive with dopamine. Therefore, it's going to bind to several neurotransmitters in these regions. However, it's going to act as a dopamine antagonist, and therefore it shall block dopamine in these areas in order to decrease the levels of it. It particularly works on the dopamine D2 receptors. It therefore also acts as a serotonin agonist in order to increase the levels of serotonin in these pathways. So it's going to specifically act upon the serotonin 5-HT, the 2A, 2C receptors, in order to help increase its concentration. So I'm now going to pair clozapine versus chlorpromazine, which is a first-generation antipsychotic. Chlorpromazine or thorazine is going to decrease dopamine across all pathways. Therefore, it particularly is going to affect the mesolimbic pathway in order to decrease the dopamine there and thus decrease some of the positive symptoms. Therefore, since it is only working to decrease dopamine, it does not help to alleviate some of the negative symptoms associated with schizophrenia and therefore slightly disadvantaged. However, another disadvantage is the fact that it has increased levels of EPS side effects, extrapyramidal side effects, which includes dystonia, muscle cramping, dyskinesia, uncontrolled muscle contractions. Tardive dyskinesia is a long-term muscle contraction side effect. Akathisia is restless psychomotor agitation, and pseudoparkinsonism is a flat active affect, muscle rigidity, and a shuffling gait. However, chlorpromazine is advantageous to the fact that it has a fewer risks of weight gain and diabetes, as well as it is not associated with agranulocytosis. What that is, I will get into at a later date. Clozapine versus Seroquel. Seroquel or quetiapine is another second-generation antipsychotic. Therefore, it utilizes the very similar MOA by working upon the integrative dopamine hypothesis. However, it is composed of slightly different combination of neurotransmitters and at different concentrations. For instance, it has a higher level of antihistamine, which causes more drowsiness with this particular medication. And it also includes a black box warning for suicidality in teens and adolescents. However, it also does not have the same risk of agranulocytosis that clozapine does. So finally, some good things to know if you're on clozapine. Some common side effects associated with clozapine are weight gain and hypoglycemia, which is high blood sugar. Together, these can lead to dyslipidemia, which is type 2 diabetes. Clozapine is also associated with some autonomic nervous system side effects, which include things like blurred vision, dry mouth, constipation, sexual impotence. As well, typically, clozapine is not recommended for if you are pregnant or wanting to become pregnant in the future. And then some more serious side effects of clozapine can be agranulocytosis, which is a low white blood cell count. And low white blood cell count can lead to increased risk of infections, which can lead to some serious consequences. And therefore, upon immediately beginning to take clozapine, blood monitoring begins in order to determine what your baseline white blood cell count is, and then it continues further on in order to determine whether or not you are at risk for agranulocytosis with this medication. As well, orthostatic hypertension is one that is slightly more common as a serious side effect, which is dizziness upon standing up. And this is slightly more serious in the elderly. Some more rare but serious side effects can be seizures and myocarditis. So for some more information, check out the websites Hippocrates, Drug Bank, or Medline Plus. And when in doubt, ask your physician. Thank you for listening. I hope this helped.